order. I'll start over with roll call. Ron Ferris.
Here.
Todd Young.
Here.
Chris Chapman.
Here.
Grant Smith.
Here.
Members, when you wish to speak, please state your last name for the record. Board members are asked to not use the chat feature during meetings. Public members wishing to speak must first sign in on the roster sheet available. For public members calling into the public phone line, please email April Fleming at april.fleming@oha.oregon.gov and provide your first and last name. Public interested parties' feedback may be heard during the public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. Meeting is called to order. All right. My turn to not be ready. All right, first item on the agenda is the approval of the agenda. If I can get someone to make a motion to approve the agenda, unless everybody's still reading it.
This is Grant Smith. I make a motion to approve the agenda.
Can I just bring up stuff during, I guess we got to vote before we can have discussion on the agenda, so.
This is Chris,
So-
I'll second that.
Okay, thanks, Chris.
So for discussion on the agenda, do I have to, if I just want to bring up open business, or do I have to identify what the business is before we approve the agenda?
Let me do a roll call real quick, Todd, and then we can discuss it, okay?
Oh, okay.
All right, roll call on approval of the agenda. Ron Ferris,
Yay.
Todd Young,
Yay.
Chris Chapman,
Yay.
Grant Smith.
Yay.
Todd, you had something to bring up?
It's an agenda item under new business to discuss Washington's readoption of rules and recertification or reapproval of schools.
We can do that in number 5 under board business.
Fair enough. Thank you.
Thank you. All right, director's reports. Guess that's me. So if everybody is looking at their reports, I am not, except on paper. So in the fiscal year 2023, we've issued 3 licenses. One in the first, or excuse me, I'm wrong. We've issued 7 licenses, 4 in the first quarter, 1 in the second quarter, and 2 in the third quarter, and none thus far in the fourth quarter. Licenses renewed fiscal year 2023. We've had a total of 104 licenses renewed. The vast majority are online, which is great. We have a total of 29 in the first quarter, 36 in the second quarter, 25 in the third quarter, and 14 in the fourth quarter. And all of those have been online in the fourth quarter. Licenses by age and gender. It looks to be about broke even between 26 and 50 and 50 to 89. We still have a couple of folks, 82 to 89, still keeping a license active.
Bob?
Yes.
Just a quick comment on that, the licenses by age and gender.
Yes.
Seeing that bell curve now that has an apex somewhere around the 50-year mark compared to 6 or 7 years ago when it was heavily tapered at 60 plus is I'm super excited to see that for the health of our profession. So
Yes,
yeah,
I agree.
It's good news. A lot of younger people.
Yeah, for sure. And I apologize for not seeing your hand up there. I was looking down.
All good.
Okay. Licensing trends. So we've been trending for the last 2 years at about 115 to 119, and we're running at 118 right now for dentures with oral pathology endorsements, and denturist, temporary denture technologists, and trainees are running the same. And so it looks like we've had a couple get their license of the temporary denture technologists. All right, the next slide will be your financials, setting pretty good. Shared assessments. If you want me to read those, I can. We have come down a little bit in the shared assessments between 2019 and 2022. We went from 1.9 down to 0.119%. Excuse me, that's the small board. And shared assessment went from 0.2 and it's been holding steady in the 0.16, 2, 3, and 5 range over the last couple of years.
Bob, I got a question about that. As that fund account, sorry, as that continues to inch up a little bit, you know, $4,000 or $5,000 a year, is there a minimum or a maximum that we need to have targeted to keep in that account for a carry forward fiscal year to fiscal year or biennium to biennium?
I'm not sure, but I made a note. I will get that answer.
Okay.
So your
And then-
expenditures should remain somewhat the same. It may go up for costs such as investigation, court hearing, which we haven't had any of. So it went up about 1,300-ish between 22 and 23, and I will reach out and ask that question. But I see what you're talking
My
about.
follow-up question to that, Bob, is if we end up in a situation where there is an investigation, you end up with a court hearing, do you have, can we find out what that, an average, if based on other boards' experiences, since that's never happened to us, it has happened to the board in Washington a couple of times and the board in Idaho at least once. And so that we can kind of have an idea of what that number should be to prepare for a single instance down the road, I guess would be my question.
This board did have a hearing. Gosh, I think it was about 2014-ish, but that was the last one.
Okay.
And I can look for those numbers.
Okay. Just curious. I mean, yeah. If it's busy work, then punt it to the next 10 board meetings. Bob, I know you got other stuff to do. So just, you know, some of those, like I've sat in on the board meetings up in Washington, and there's like an assistant AG and 2 other legal assistants. And I mean, their board meetings are like $10,000 or $15,000 a shot. And they have them quarterly. So
Wow.
yeah, it's totally run different than, I like how we run ours. So
Yeah, I can tell you that, you know, for 10 hours, it's probably upwards of 20 grand, 15, 20 grand.
Yeah.
And I see Sammy's hand is up and you're muted, Sammy.
Hi. Just an FYI, when the board decides to start rulemaking again, there will be AG costs for that. And I don't know exactly what that will look like, but there will be whenever we decide to open up rules. I've been waiting for Cerinthia to complete the review of curriculum and school approval and piecemeal pathways and all of those things, but I'm not sure at this point down the road when she'll be done. So I do need to do a 5-year rule review, although I'm not sure exactly when I changed them last. So I need to kind of do that review. So I will say at the next board meeting, I will have more information as to when you guys did your last rule review. How about that? And
Perfect.
we'll go from there.
Yep.
Yeah, and there may have been costs that we're not even thinking of, something that came up during an investigation or something that we reached out to our AG with questions in the last year, but I don't recall off the top of my head.
Okay. Thank you.
But we will
Appreciate it.
we will get some answers.
Thanks,
And
thanks, Sam.
I don't think there is a max or a minimum. All right, that's all I've got. Trampus, are you there?
I am here. So I'll be talking about the regulatory report. As you can see, there's one biennium that shows up on this regulatory report. However, in actuality, that one case is closed. So the 2023 case that you see showing up there is actually closed. It was a case that had actually been previously done. We closed them when the notice goes out. So there was this case had a discipline, a notice of discipline on it, and that notice of discipline went out, which takes the case off of this report once it goes out. So that has actually happened on that case. So this report should actually just say 0 open cases. So yeah, we're in pretty good shape as far as investigations go for you guys.
This is Ron here. I just question it. Last time there was a discipline case, it was on Oldenburg, and it came down a charting deal, either pay the fine or take a class, if I'm not mistaken. He died shortly after that. I don't know that either one of those got completed. Would that close the case? Or is it just left?
Are you talking about the last case that we had with the stay on it? Like we talked about in the last case? Yeah, that's this one. I didn't know that he passed away.
Yeah, he did at the last meeting. I didn't bring it up because it was short. I just happened to got the call and went over to the office and talked to the family. It's all well and good, but I would assume that it was closed. You might not have no way of knowing, but I doubt if he's going to pay the fine or take the class. So
yeah, or respond to the notice, because that's where we are. We sent out the notice last month, and I don't think that there's been a response to it. So that's probably something that I should look into, so I can officially put that in the file to close it out. So
yeah, that might help you guys. I mean, he's not going to renew his license. That's when it would come up in the future. But it might change an embarrassing moment if we made a note that where we're at, and you can close it even cleaner. Thank you. Okay.
Okay.
Thanks, Ron. Sammy, your hand is up.
That was the old up.
Okay. Trampus, are you done?
I am done.
All right, Chair and members of the board. I need to go back a little bit on the director's report. I forgot one little piece. It is the board member status. And I'll just do that real quick. Ron Ferris, who's the chair, his term expires 2/28/26 and cannot reappoint. Chris Chapman, term expired 9/25/22. Thanks for hanging on, Chris. And cannot reappoint. Todd, his first term expires 3/14/2024 and can reappoint. And Grant, your second term ends in September 22, 2025 and cannot reappoint. And we have one dentist and 2 public members vacant. Okay, any questions for the director's report or for the regulatory report? Sorry, I had to go back a little bit.
I have a question, and this may be, you want to kick this down the road a little bit, but I had a dentist call me and ask if he could be on the board, and I told him I would bring it up. He said he's contacted the board or your office several times, and I don't know how that works or whether that was true, but he did express some interest, and so he asked me to ask you, and I'm not
Yeah.
sure.
By all means, I'll have Derek, who's busy this morning. I don't know if he's on. I see he's on. I don't know if he's in his office. Reach out to you. And that was Chris,
Okay.
right?
Grant.
This is Grant, excuse me.
Grant,
I'm sorry.
sorry. Because I'm sitting here looking at Chris and his mouth wasn't moving.
Well, you
All
can
right.
tell us apart. He's a good looking one, so that helps.
I thought it was you guys were so close to looking the same that one of you would be on camera, the other one wouldn't, so I wouldn't get confused, and I did it anyway.
Well, if you insult him openly like that, he might leave the board.
But
I'll just sit here and smile, that's all.
all right. All right. If everybody is ready, we are on the next topic, which is the policy. And we have Sammy here.
Sorry, I was making a note. First thing on the agenda is legislation. So I'm sure you all know that the Senate has halted really any progress with legislative session. We don't know if they're going to come back. It doesn't look good. So basically any bill the HLO is or general bill the HLO is named in would not go through. We only actually had one so far. Hold on here. Where's it at? I can't find it now. It's a behavior analyst bill.
2048.
I don't know. I can't find it on here, but there was one that passed, but doesn't affect you guys. So the gist of it is Senate Bill 412, that would be licensing dental labs, would not take effect. So at some point we may look at, whoever sponsored the bill and whoever put the bill up may decide to do it again. We'll just have to wait and see if they do it in the short session during 2024 or something in the longer session of 2025. Other than that, this is the wrong report. I think is the problem. Other than that, there you go. So that's that. I do want to, yes.
This is Ron. On the phone, I raised my hand. The only other one in the pile here was the interpreters, and it was never clarified whether denturists are in that group. May or may not be finger pointed for having to take care of the interpreters. So,
Do you mean for the previous legislation?
the HB 2696. It's on this.
Yeah, that.
Came and
Oh
went.
no, that's
and
actually a bill that would create a board called the Sign Language Interpreter Board.
Interpreters.
That's actually not.
Okay.
I think what you're talking about is a previous bill that passed in I think it was 2021 that required certain healthcare professionals to offer patients interpreter assisted anything, whether they could do it or somebody else. And I did find out information on that, but I'd have to find it. Can you tell me if in any scenario, can you guys bill like Oregon Health Plan and they pay for a service provided to a customer at this point in time?
I couldn't answer that because I'm not in the Oregon Health Plan loop. I'm not at Medicaid office here or Medicare office here. But in the past, they did have some support, but they did it on their own. No, I don't have the answer to that question. So I just trying to avoid it. I haven't been addressed with it. Just,
Hey, Sammy, this is Chris. Can you ask that question one more time?
Yeah, what it comes down to is whether or not public funds are provided to a denturist, so say Oregon Health Plan, if they were to bill Oregon Health Plan for a service provided to a customer, a denture service. And I have the answer. I'm just looking for it right now.
So this is separate from, I think if I'm understanding Ron's first question, Ron was asking about the interpretive issue. So this is separate from that, Sammy. This is, your question is, doesn't have to do with that. Is that correct?
Doesn't have to do with what?
The interpretive, like if, how the interpretive bill is playing out between the denturists and the state.
I'm not
But-
sure what that is, what you're talking about.
Okay, so you're asking a separate question. You're asking what the experience of any denturist professional that has a relationship with Oregon Health Plan, how that experience on a financial situation is
Yeah.
going.
Yeah, like, so, for example, well, I guess I have two questions. One, what exactly is Ron talking about? Because the bill before the legislature now is just nothing to do with denturists. It's to create a board for interpreters. So that's the first thing. So what exactly is he talking about? I think he's talking about a previous bill that requires healthcare providers to provide interpreter services to clients, period. And if so, I have that answer. I'm just looking for it now.
Okay, that's what my
So
take.
this
on
is
what
Grant.
Ron was saying.
that's correct.
Grant.
Yeah, this is
I
Ron.
think-
That's correct.
I think that the crux of the issue was that the bill went through, but there was no language about who would pay for the services. And I think that that's where things sort of got lost, and we don't know the answer to that.
Oh, you would
Those who
pay for
did the
that.
bill were pretty ambiguous. Yeah. So, okay, you go ahead. Oh,
So yeah, it looks like yes. So you can bill Oregon Health Plans, so you would be included in that. It says that dentures under provider type 20. And so they do enroll denturists to be paid through Oregon Health Plan. So yes, you would be required to have that, to provide that service to customers. But I will get you more information, something in writing that explains that. I'm sure this has been on a to list somewhere else, but I have not done it.
Yeah, this is Chris. That would be helpful because, like the previous comments, for those of us that are still billing the state for those contracted services, we're still out of the loop on
Okay.
how that played out on our end.
So maybe what we can do is do like a practice clarification that clarifies that this bill does this and denturists are required to do this. And so I can probably have that for you at your fall meeting, along with the rule information, and then you guys will vote on all your 2024 stuff.
Okay. Yeah, and this is Ron. Thank you, because there is just two parts there. The one saying that if you get an interpreter, it has to come from an approved pool of interpreters that hasn't been described yet, but that's what they're trying to work on. So it's pretty much individual right now. If somebody finds that they're find access to an interpreter, which will help the situation, then they're just going to have to kind of go case by case basis and look into it. So that's the avenues there. That sounds good. Okay. Yeah.
Okay, so next, if that's all, next on the agenda is that all? Is mobile denturist labs, and The gist of it is your statutes are silent, so if a denturist wants to have a mobile denture lab, they can. What we will, you still have to have meet all the same requirements as a brick and mortar place where dentures work. What we would look at is maybe a rule that specifies what a mobile denture lab would need to have. I don't know how often this is happening. If it's something that's desired, I don't know. So that can definitely be something we talk through more in rulemaking. So just for future, but what I'm gonna do is do a practice clarification and I'll present that at the fall meeting. I just didn't have time to do it because I just got the information back.
Todd has a question.
Yes,
Yeah, so I think it's more of a, making a point about the Board of Denture Technology and making sure that we're clear with staff that denturists are clinicians, not lab technicians. And so like,
oh, yeah,
just a simple
sorry.
thing is mobile denture lab, mobile denture clinic update going forward, Sammy, and just making sure that we're addressing this as clinicians and not as laboratory technicians. There's a big difference on a professional standpoint there.
Yes, you're right, as far as the person, but if a denturist wanted to call their mobile place a dental lab, there's nothing precluding them in your statutes to do that. I don't know if they would, but definitely not. There's nothing prohibiting it in your statutes. Maybe there is in somewhere else. I don't think so.
I guess when I hear mobile denture lab, I think of an unlicensed dental technician driving around in a van performing laboratory services at dental clinics, for dental clinics, and not direct to public services as a denturist, a clinician would do. That's all. Does that make sense?
Yeah, no, the question was, can a denturist operate in a mobile place?
Right. And you specify that the lab or the van or whatever vehicle, but in reality, the statutes, practice standard statutes would not only apply to the van, but also the clinical environment that the clinician would be working in. In other words, taking impressions in
Right.
an assisted care facility, maintaining asepsis in those conditions. So I think it's a bigger, that's all. It's the van is less important to me than how the asepsis is being performed and the patients are being protected.
Right, and and I said that all other rules would have to be adhered to, and you do
Got it.
have some practice standard stuff, but there's nothing saying that a person can't realign, adjust, create all the things you can do in the statute in a mobile place. Not that
Are we-
someone would, but there's nothing precluding it.
I was just asking, so are we
Oh.
are we starting to get some rumblings of someone doing this and there's some complaints on the horizon? That's
No,
Or-
it was a
okay.
denturist who wanted to be able to do it, and I've had a few calls about it since
Got
COVID.
it. Makes sense. Okay.
Nothing
Thanks for
complaint driven
clarifying.
though. No
Yeah,
problem.
Thank you for clarifying.
Okay. If there's no additional questions for Sammy on policy, I'll move into public interested parties feedback. At this time, the Board of Denture Technology will hear public and interested parties feedback. Members of the public, please wait until you have been recognized. Once recognized, please state your name and affiliation to the board for the record. Is anybody online, Nathan? Hearing nobody on the phone, we can move into other board business, and Todd Young had something to share with the board.
Yeah, so we just had our spring conference, or our annual conference, I would say. It was a joint conference with the Washington Dentures Association up in Skamania. Went really well. But one of the interesting things that the Washington board actually conducts a board meeting at the association meeting at huge expense to their board. So I'm not advocating for that, although I'm sure there's a lot of folks that would have loved to have come to Skamania to present their reports for a couple of days. But the most important thing that in my mind that came out of there that kind of might affect our regulatory board is that the Washington Regulatory Board adopted recognition of only 2 of the 3 pathways to licensure, and will no longer accept or recognize licensure by through piecemeal. And it's something that I'd like to talk about going forward, actually removing from the pathways to licensure in Oregon. So,
Okay.
yeah.
This is Tina. Can I ask a question? So why? Why would you want to not allow piecemeal?
Because we're a clinical profession working directly with the public through independent licensure, and we would be and are the only profession and state in the United States that recognizes that pathway to licensure. All others have a third-party accreditation system where the schools are approved, are regulated either through recognition of a Department of Education accredited institution or a professional accreditation.
Thanks.
Can you send me that information, Todd?
Yep.
So here is my feedback. I think it's something that definitely sounds like we're building up things to do in rulemaking. So possibly doing a review sooner rather than later. And with legislation not going through, I have some freed up time. Well, I never have freed up time, but I could fit it in. So would have to look at the statute, because something interesting about your statute is it doesn't even require that you have an associate's degree, but you have to have the equivalent. So I'm not sure you actually have the option to remove it, but it's definitely something that we can look at. And if it's not something you can remove, we could talk about, legislative language to make that change. But definitely something to talk about.
Perfect.
This is Ron, and if I can chime in for a second, I think it's interesting that, where it's at now. A lot of those avenues are kind of going away. We're in a dilemma, so to discuss that, I think it would be great for me to recommend that we have a committee of a minimum of board members and some others in the profession and discuss this, and then recommend something to the board by committee on whether we should dilute, get rid of the accreditation platform that has been there. So anyway, I think what I'm putting forward is I'm putting a recommendation that we have a committee of peers and maybe Department of Education or something that can help us see the ramifications of such a change.
So this is Tammy, a couple thoughts. So whenever you do, what we're talking about is what I said before, a rule change. So there's a process, and within that process is a rules advisory committee. And they're not board members, they're denturists in the community, other healthcare professionals, the public, that would review anything that the board proposed. However, OHA has done a big push for community engagement before rulemaking commences. So I think there's definitely merit in doing some maybe a couple. I don't know if there'd be interest in doing a presentation, basically like a town hall, where people would give us information and we would take it and then we would draft proposed rules. The RAC would see them and then eventually go to the board. The other thing is there's nothing prohibiting you from doing a different type of meeting, like a work group or a committee. It's not something we normally do, because at the end of the day, the board and all the board members have the final decision. So when we're drafting proposed rules, we don't usually have board members doing that because they make the final decision. But there is, I think, merit in doing something with educators and people that are doing these things, which could be board members. We just want to make sure we don't have a quorum of the board, and maybe Department of Education, maybe HEC. So something we can definitely look at. And Corinthia usually does her qualification committee before I do rules. So that might be something that is rolled up in her stuff. But like I said before, if she doesn't have the time for that, it is something that I could do. So yes, I'm going to write it down. And what I would do is when I do your rule schedule is I would build that in to the schedule.
Okay.
I have a
Yeah.
One more thing. There's also, we have one board, the Board of Direct Entry Midwifery, who the board acts before rulemaking starts. The board acts, they go through all the rules and write them how they think they should be. So they've taken 3 years to go through it line by line. I'm not kidding about that. And then the rulemaking starts where Iraq meets and da. So if you wanted to designate 2 hours of the next X number of board meetings for the board to look at the rules, review them, give different language, point out ones that need changed, whatever, the board could definitely do that. If that's something you're interested in.
Mm-hmm.
There's so many methods.
Yeah. Well, I think on the surface, they're the big picture to eliminate the degree authorized piecemeal bricks and mortar places that have been available as an avenue are disappearing. And some of the lab programs are not there, and some of those schools aren't there. So we're up against a situation of being limited where we can get education. And so like the American Denture College or avenues that are very viable, and it's kept things going. So it's just when we lose an avenue, that's one thing, but to just stop an avenue while it might still be there, I need education on that. I'm just curious. So thank you for the help in any direction, and I'm sure the board agrees that it's not up for discussion, it's up for education. Okay, thank you. Yeah.
Tina?
Mm-hmm.
Yeah, I just had another question for Todd. Did Washington talk about reciprocity at all for any individuals? Because, currently it's very difficult to come into Oregon unless you, unless you go to accredited school.
So, and it's going to get more difficult for Oregon dentures to have portability of their license going to other states as well. With this, this has already been discussed at Maine, the Maine Board of Dental Examiners. It got tabled at an earlier meeting about a year ago, but when the Washington thing gets out, Oregon and Washington have been pretty tight. The only issue that has really stood between the two is this: if you get licensed in Washington a day before you get licensed in Oregon, you got to wait 2,000 hours. So the second aspect that I'd like to address is getting rid of that hours requirement and making it more uniform with the rest of the denturist world across the regulated states. So the first thing I want to look at doing is going to an associate's degree minimum in denturism. The second thing is getting rid of the 2,000 hour minimum if you're coming in from another state. That's ludicrous. No other profession has that either. And the third thing that I want to go into when we open up rulemaking is I want to open up scope of practice so the denturists can take radiographs, not to diagnose, but to interpret, to refer, because as an access point to care, we are often, once a person is completely a dentulous, we're often the only place that those people are seeing for their oral health. And we need that key piece of diagnostic data to be able to refer them out to ensure that their oral and overall health is being maintained. So those are the three pieces that I want to touch on, Sammy, Tina, Corinthia, regarding opening up our statute.
Ah, okay,
Yep.
good. So all three of those items, no matter what, I can say this confidently, will need a legislative change, which I'm more than happy to help create language, work with the association. Anything HLO can do before it gets, started in the legislature, so we can make sure the language is right.
Why are we bringing the
Similar,
association in?
or whoever, I don't
Okay.
know.
I'm just curious.
HLO would not sponsor. I guess the first thing is HLO and the health authority would likely not sponsor a bill like that. Since we went into Oregon Health Plan, actually the last time we did any type of scope of practice change was denture, was adding the other orthodontic appliances. That was the last
The
time.
definitions, the definitions.
So we don't
But-
do that anymore.
But clarifying education doesn't fall under what we would do as a board.
We haven't sponsored anything. HLO and OHA has not sponsored any legislation since we went under OHA. We did a couple cleanup things like add a comma, stuff like that, but nothing else. And another entity or person has brought forward any other legislation. Not to say we can't, but it's
Okay.
not something that we've
Okay.
done. So that's why I brought
Okay.
the association in.
Got it.
I
Or
have,
Todd, as an individual, you can do it. Take off make sure you delineate that you're not doing it as a board member, but as a private
Yep.
citizen.
Yep. Okay. Perfect.
We can
And
work
then-
through all those things too. Sorry, Tina.
Awesome, Sammy. Thank you.
Tina?
And then Sammy, Todd, I have one other question. What about individuals that have been licensed for 25 years? 10 to 25 years wanting to come into the state. I mean, what is your guys' take on having a pathway for those individuals?
I personally, this is me taking off a board member hat for a minute because I don't know that I haven't reviewed the statute or administrative rule surrounding this. But if you're describing a situation where a 25-year licensee that has been whose CE is up to date and whose license has been maintained and they're coming from Washington to Oregon, I would absolutely welcome them with open arms.
Thanks.
Is there anything wait, Tina, are you asking somebody who's been practicing or somebody who's been licensed?
Licensed?
Is there something precluding them from coming into Oregon now?
Yeah,
Yeah,
Yeah.
there is.
you have to prove 2,000 hours of practice if you
Well,
have a license from a different.
You have to
state
prove
right now.
three years of experience. Is what the
I
statute
think it's
says.
2,000 hours. I don't think it's 3 years, Sammy. But you're in the legal end of this a lot more than I am.
I
Right.
think we're talking about two different things.
Okay.
Somebody who's not licensed in Oregon, one of the methods to become licensed is, as you know, get the education and then do X number of hours in experience. But somebody who is, I'm looking this up. Somebody who has a license in another state. Hold on, where's it at here? Applicant without exam submits an application. Passed written exam. It says has engaged in full-time active practice of denture technology as a licensed denturist in another jurisdiction for a minimum of 2 hours immediately preceding the date of application for licensure.
2,000 hours, right?
It says 2 years of experience. I don't know. I have to read the rules to see if we've broken down that 2 years.
Yeah,
I don't
okay.
think we did, but definitely we could. So if someone's licensed in another state, the only way they couldn't come into Oregon if they have been working for 25 years is if they weren't working for 2 years preceding their application in Oregon.
Tammy?
Otherwise, they can come in.
Okay, you have to prove that you've taken the exams. You have to prove your education. And somebody that's been licensed for that long and practicing, sometimes it's very difficult to get those transcripts or the exam that they took. Especially coming
Oh.
from Washington, if you took it in prior to 1996, you fall under one category. If you take it after 1996, your
Yeah,
your
Tina's right.
practical's good, but your other stuff's wrong. So I mean, you've got a person that's been practicing for 25 years, needs to come to Oregon, can't. So
Tina's right.
it's,
It says you
yeah.
have to have passed a written and practical exam. So my suggestion would be that you just take this out. You would delete this whole law and you'd maybe put just a statement where it says the board may hold on, I'm looking for it. Board establish policies and criteria for assessment. And that's just no, that's not it. That's not it. Anyway, there's a spot where the board can do other things, and you would just say can license people through reciprocity, period. To be determined by
With states
rule.
that have substantially similar scopes of practice and regulatory requirements.
Yeah, you
And
could
then
write
have a
that.
list of states that we've identified that meet those that we address every 3 to 5 years. To
You
make
could
sure
even
that
be
they're,
more vague and just say
Yeah.
as determined by rule, and then write all that in the rule.
perfect. That's
Totally
even
up to you
better.
guys. Something else we could do, I'm creating myself more work, is you could do a legislative committee where it could be made up of some board members. This is all stuff we used to do, which is why you guys are bringing it up, because we used to do it this way.
Yeah,
You could even do that
Yeah.
where we look at all, it sounds like we have several you would want to change. So all those things are definitely on the table. I'm going to write them all down. Tina, that was a really good point. Yeah,
I love
think
it.
these
Thank
are
you, Tina.
all really good points.
Sorry to make a short meeting long, Bob.
Oh, hey, no problem. It's your time. I'm not watching my time.
Yeah, this is Ron, and there's a lot of, good conversation. But if I remember, and Todd can help with this too, what year it was, but when you were saying that the board doesn't make the decisions on educational and the requirements, but when the curriculum, for lack of a better term, I don't know if it was American Insurance College by name at the time, but if the way that I perceived it was a letter from the Department of Higher Education was put in front of the board, and the board approved it for entry-level education to become a denturist and get a license, which sounds like the board made that decision. And what Todd's asking now is for the board to make a decision on cleaning up or reviewing the educational requirements again. Did I miss something there? What the board can and can't do? I thought that's where I'm listening. Okay.
I'm not, this is Sammy. What we were just talking about was related to statute, which has to be a legislative change. I'm not exactly sure what you're talking about. I think, yes, in the past, we have had HEC involved in certain aspects. They are more limited in what they'll do now. The last time we did any kind of a look at that, I did it, which is never a good thing when I'm looking at education. But we could look at that stuff, and I think that they did provide information on the equivalency with other states and programs. So they just don't do a lot of that stuff anymore. So, but those things we could look at. But what you're talking about, Ron, is a rule. Laws sometimes limit us, like this reciprocity law, saying you have to do X, you have to do Y, and one of Y is pass a written and practical exam. And that's substantially equivalent. But like Tina said, if they did it 25 years ago, that's nearly impossible to prove. So some of these things we can do via rule. Some of these things I don't think that we can. But I
Okay,
think those are all good things. I'm going to write them all down.
Okay, thanks. Yeah, that's good. I just, if it's easy to get something started, but it's difficult to stop something, sounds like a union. There's reasons for that, and we just want to keep all the good reasons in place. So thank you, guys. You do good. Good.
Okay. Any other questions or discussion for other board business? Okay. All right. So if there's no objection, I will adjourn the meeting. The Board of Denture Technology meeting, was there an objection?
No, this is Ron. I was just thanking you in advance for being the voice out there, because I got a phone on my ear. Thank you.
Not a problem. Our pleasure. All right, the Board of Denture Technology meeting is adjourned at 10:07 a.m. Everybody, have a great week. And if you have